Hey guys, good morning. On my way to do the Neogen face today. Did the preparation, well hydrated and everything, and hey, come along, you're with us. All right, guys. Wednesday morning. Here's a close-up of my face before the procedure. Just kind of zooming around, and that is me. My wife, just a little brief drive. We are going to Aesthetically. It is located 1801 West Norton Road, Suite 100, Springfield, Missouri 65803. And we're on our way. We took the route of Connie Street, turned north, right, and the small highways to West Norton Road. Hey guys, we are here. We just arrived. In the door, and there we are. This is the office and the layout. Very nice place. Lisa and Greg have been in business maybe just a little under a year right now, and just signing the forms right there.
For the first week.
After the first week.
Well,
Okay. A little bit
you
of a
should be able to
rundown
use
on
it within the
procedure.
first week. Someone said it felt like they were burning their skin.
The exosome?
Mhm.
Okay. And Lisa and Greg, I think they've been in business
exosome on
probably
you,
about
it doesn't
8
burn.
months now.
So you should be able to use it within the first
Super nice
week.
couple. Okay.
And it not bother you
Within the first week.
after wait till
4
4,
days?
yeah.
Okay. Just kind of getting a little bit of information, and then heading into the office. There's Lisa.
It's got all this stuff.
Maybe not.
Before picture.
I need a step stool to take your pictures. So tall.
Lisa said she had to grow a little bit to take my picture there. All right, Lisa fixed me up with a hydration mask before I was ready to undergo the procedure, and just kind of sitting and just chilling into the office, listening to some music, getting my IV hooked up for further hydration, B vitamins and glutathione, and just getting fixed up here. And then right here, about 30 minutes before my procedure, this is a numbing cream. The actual treatment, there's not really any pain involved. Uncomfortable, yes, but strict pain, really not that much. But it is an uncomfortable procedure. My wife, whenever she underwent the procedure, her joule settings for the Neogen plasma treatment were on the low side. She was like about a 0.8 throughout most of her treatment. But on her cheeks, if you've seen our earlier video, Lisa did go up to 1.2 joules with that. I am just sitting here, waiting for my IV to do, and just like I said, waiting about 30 minutes for the numbing to fully take effect. And got that done, and heading into the office with my little IV bag in tow, and ready to get on the chair, and we are about ready to start. position. The first pass that Lisa's going to do on my face, she has a pattern. I really wasn't aware of it, but she'll have a pattern.
It's working.
On the first pass, she'll do like 1.2 joules of energy just to see, just to get the skin ready for it, and for the next pass. And that's the unit there as well. Generally, if you're going to receive a low energy session, you can expect to take maybe 2 to 3 days off work.
Just this off of your face.
If you're going to have a high energy session, and this is just dependent on your skin type, just kind of wiping off the numbing cream there, just to get ready for the procedure. But anyway, yeah, guys, with a high energy setting, you can experience some swelling, some hyperpigmentation, and some discomfort. Some people will use cold compresses, immediately afterward, but generally, a general rule of thumb is 5 to 10 days off of work, and then she's just kind of testing the energy settings right here and how I react. But this first pass, it was 1.2 joules.
Okay. So we're going to go in sections. We're going to start at the top of your face, and we're going to move down, and I'll do your right half.
Lisa's
and then we'll
explaining
go to
the
your left half.
passes that she'll make and the problem
we'll do a
areas
second
that
pass,
she'll
okay?
focus on for me. And then it's just one side of the face, and then it will be the other side of the face.
Make sure I got high enough here.
I took off roughly about a week. I just wanted to see how my face would react to it. And here we are, we're getting started. I was interested in this procedure from my wife, actually. Just starting the treatment now. This is at 1.2. And like I said, there's no pain really involved. It is slightly uncomfortable.
See here where I've treated him, how it's shiny, and it's
Lisa's
not as shiny
just
there.
judging how the skin is reacting right now to the treatment. It will kind of singe the hairs a little bit. You'll kind of smell the hair
So in spots where you have sun
burning a
damage
little
and
bit,
you have
but
moles and things like
it's
that, we do some
not
extra
that
passes on
uncomfortable.
those to help those.
like I said, my wife has undergone 2 treatments already. And her second session was easier than the first. She's from the Philippines, and so her energy setting primarily for her treatment sessions was a lower session or a lower energy level than mine, and that will depend on the pigmentation of your skin. And Lisa's been trained with this. And so she knows kind of, especially what to look out for. It looks like I'm slightly reddening a little bit, but the 1.2 energy setting was, it was easy to deal with, actually.
Sometimes if we send you little hairs here on the side, you might smell.
Wasn't bad at all.
Hair burning. It's normal. Okay, I'm gonna
We are,
go
Lisa's
down
just
your
kind of
nose
checking here, and
So
she's
I'm going to
setting this up.
protect your eye here.
Looks like she's doing the eyelids right now, around the eyes. This wasn't painful at all either. I was slightly concerned about in and around the eyes whenever getting ready for the procedure, but there's no problem at all. the way I prepared for this session was I drank roughly about 2 liters of water each day, prior. For about a week, I drank about 2 liters. And then I would use facial mask for hydration also. And that is kind of how I prepared to undergo the session. And Lisa's getting my jawline right here. But yeah, that is kind of my preparation
Appreciate it.
before the procedure. In and around the neck is a little bit more sensitive, but not that bad. You kind of get used to it as the treatment goes along. You kind of get more used to it.
All right.
And then Lisa will just kind of check on you to see how you're
same thing. Starting
reacting.
on the forehead and going down.
Further into the video,
Is this a scar?
after this initial pass, Lisa will see how your skin reacts to a higher setting whenever she passes and repasses your problem areas. Like my problem areas are, I had some sun damage on the forehead,
What'd you say?
and then the frown lines around my mouth. Lisa hit that a little bit more for me. Those are kind of my problem areas. And then she also made a couple of passes in and around my eyes. My eyes after the procedure were slightly swollen, nothing drastic or anything for a couple of days, but really I had no problem. After the session, my skin felt slightly hot, but
The second
Lisa,
pass you'll do
before
them
I
in a
left
different
the office, she
direction, which helps lift your
put
jowls,
a
which helps
mixture
lift
of
your
the
eyelids.
post-treatment
So that's another reason for a
salve
second pass.
and the exosome
Okay, I'm
treatment.
gonna go underneath your nose here.
And then after about 4 hours, I didn't really have any lasting heat in my face. That kind of dissipated, and I was kind of surprised. But
Do the tip of your nose. It might feel kind of weird.
on my forehead,
Right here around your
I
mouth,
seem
so
to start healing very quickly, actually.
I'm gonna go below your lip.
And right here, she's kind of doing around the lips. This area is a little bit sensitive right here, for sure, in and around the lips. And then I also experienced some increased sensitivity on the upper lip as well. On the bottom lip and the chin area was really no problem. On the forehead area,
How's that?
it
Yeah,
will
let's get
feel
it
a little
on.
bit raw,
Okay.
but really I had no problem. On the cheeks, also no problem at
Yeah.
all. But just
Gives them a
slightly
little
sensitive
treat.
on the upper lip for me and in the lips. And whenever Lisa was doing the eyelids, it really wasn't very sensitive there. But with the eyelids, she will decrease the amount of energy. So because the skin is a lot more delicate in that area. I don't recall what the energy setting was for the eyes, but it is significantly decreased. Okay, here we are, starting here on the other side. All right. Lisa's just kind of checking to see how my skin is reacting. And just kind of doing the top there of the eyebrow. And then just kind of an assessment.
Take a look at you.
Lisa's made
You
the
wanna-
two
you wanna see
passes
yourself?
there. She's done both
What'd you think?
sides.
Not too bad.
And
The cheeks were easier.
my
The
face
upper
felt
lip
a little
kind of
bit raw,
smarted. The lip smarted.
but
Yeah, but
wasn't bad
the rest
overall.
Wasn't too bad though. The cheeks
and
were
like I said,
easy.
my face was very
The forehead
numb,
wasn't too bad.
so you really don't
Okay,
feel
I'm
it.
gonna do a little more
But
on your left
just kind of
side.
checking to see how the patient's doing,
Do you s-
and just kind of assessing
Yeah.
again my problem areas.
You see here how
mostly,
it's more volume than here?
and where I needed the most
We're gonna
work
do a little
on.
bit more on the left side.
Lisa's super great about assessing what you need. And during this second pass, Lisa did try, there she's kind of doing a spray to just kind of cool the face off a little bit, and that does feel great whenever she did that. I will start off at 1.8, and you can definitely feel the higher setting.
Okay, this is exosome.
And my skin reacted. It started turning a little bit white, kind of just a slight blister at 1.8. The power settings can go up to 3 joules, you know, depending on what you need done and what your pigmentation type. But at 1.8, my skin was reacting, and so Lisa brought it back down to 1.6 to finish up my treatment due to the reaction of my skin. Right here, she's applying the post treatment exosome, and right
How do you
here, right
do the
now,
aquaphor
this felt
around the
very
eyelids?
good.
Just gently,
At this
just
point,
like you're
your
doing now.
face is pretty hot
It's a post-treatment balm.
Okay.
with the
yeah.
stored heat.
Yeah, just be gentle because
But,
you're gonna start peeling in about 3 days, and you
part
don't
of the
want to
process.
prematurely rip your skin.
But
Okay.
you can feel this is possibly a strange thing to say,
Mom
but
feels
you can
good.
feel the
Feels
skin just kind of immediately go into a healing phase, and it does feel tighter.
I'm gonna put on your lips too, so that those
Your
can
lips do feel pretty raw if you
get that
choose to
benefit.
have your lips done. But
Yellow,
anyway,
greenish.
and just continuing with post-op care right there. Now the Lisa said, do not wash your face, and I could not shave for about a week after the session, and not to really even take a shower for about a week after the session.
Yeah, you could be red tonight. and maybe
Lisa
even a little bit
gave
tomorrow.
marching
You
orders
thought you had
to
such a
start
high
using
treatment.
the silver
That stuff feels good.
healing cream after about 4 days, and the
It holds
exosome
in the heat.
also
Doesn't-
exosome
isn't it has
stem cell product
I'm putting
also to start using that after about 4 days.
Mhm.
But just continue with the post treatment salve, and just kind of continue. Hey guys, just completed the Neogen treatment. I was on a higher setting than my wife. It was 1.2 joules for the first pass on the face overall, and then after that, Lisa just kind of did a second round. I was able to tolerate a 1.8 joule power for a while, but my skin started having a reaction to it, and so she backed it down to a 1.6. I have a scar up here on the forehead. She passed over that about 3 times, and then went down here kind of in the jowl area, and right here on the frown lines of the face. going to start applying this very soon. It's kind of an aftercare right immediately after the procedure. Some various things here. Cleanser after about 4 days only with the cleanser, and then the silver, which will help with the healing process, the healing silver lotion. That'll be after about 4 days as well. Let's see. Anyway, but primarily right after this treatment session, whenever your skin starts to feel a little dry, just this all over the face, on the lips, even on the eyelids. Anyway, started the journey with this, guys. Hey guys, first day post-op after the Neogen procedure yesterday. The face is healing up well. The redness has decreased quite a bit. I don't really have any pain or any soreness. I do have some tightness, which is natural from the healing process, but the healing process is coming along very well. Just using the post-op cream right now, but everything's going well. Hey guys, day number 2. My face is starting to peel a lot. I have no pain whatsoever. It's just a matter of keeping the area clean, applying the post-treatment lotion. You've got also a lotion for the PM, but I still have significant frown lines, of course, but this has lifted up considerably. Well, you can kind of be the judge of that yourself on the video, but anyway, it has kind of lifted and contoured. Day number 3, guys. Doing pretty well overall with the healing process. Started doing the silver to kind of help with the healing and the itching. The dead skin has sloughed off quite a bit. I haven't just aggressively washed it at all. It's just kind of a patting, you know, my face with the cleanser that they give you, and the skin has come off pretty readily, actually. It's been about 3 days, and so I've been using the post-treatment cream very religiously, and it's healing up well. Hey guys, day number 4, healing up really well. Still itchy, new skin, of course, coming in, some slight hyperpigmentation up here on my forehead. Lisa did the triple pass here on a childhood scar, but healing very well. The beard is about to drive me crazy, but overall, most of the peeling is done with, but yeah, anyway, healing up nicely for day 4. This is the final installment of our stages. I am actually 10 days out, not 7 days out right now, but overall, the process wasn't that bad. I really started, as I explained earlier in the video, I really started healing well and peeling quite a bit around the 3rd day. My skin was completely peeled off, the old skin anyway, after the procedure. After about 6 days, it was completely clear. My skin, let's see, to kind of use my wife's explanations, it's new. It's new, and so you have to be careful. You have to take precautions. No direct sunlight, no scrubbing whenever you wash, but overall, it's healed. The first time I shaved felt really good. I shaved for the first time after about a week, give or take. And anyway, pretty pleased with the results, and appreciate it. Thanks, guys. Hey guys, just a little forward before we take you on my Neogen journey. Uh, I am 10 days out from the procedure. Had it done Wednesday, week before last. Had the procedure done at Medically Aesthetically. Greg and Lisa are the proprietors. Lisa did my treatment and she was fantastic, did a fantastic job. I am super, super happy with my results. Um, a little bit more about the Neogen plasma. It, in essence, it's thermal heated plasma and has different treatment settings. At the deeper settings, it can go down to the reticular dermis, and that can be anywhere from 1 millimeter to 4 millimeters deep. So it does have a deep penetration. The thermal heat activates the collagen and the elastin in the skin, and so your treatment session after you finish up is going to kind of continue on for the next 12 months or so, which is really, really fantastic. It's just your body's natural healing response, and it just regenerates, resurfaces, and it tightens and lifts the skin. Um, my wife had it done for acne scarring on her cheeks, and she's been really, really pleased with the results. Mine is just sun damage, and it's toned my skin up quite a bit, and especially around my frown lines. Anyway, guys, you're going to see how I looked from each stage, from the first day to the fourth, and then my fifth day, or my fifth picture on the fifth stage was on the 10th day. But guys, this is my journey.